Rob Welk, and I'm the owner of Welk Security and Trust, which is an insurance agency specializing in health insurance. The reason for I created my channel is to try to help customers understand what they can do to save tens of thousands of dollars on their health care, health insurance over their lifetime, and hopefully in the process earn their business or keep their business. So a couple things I want to point out that are going on right now that are in the news. First of all, the Medicare Part B premium was just announced, the increase. They're not allowed to increase it more than what you're seeing as an increase in your Social Security. So it's really difficult to tell clients exactly how much it's going to increase for them personally. Because if your Social Security goes up 2%, let's say you're making $700 a month, that's a $14 a month increase in income. It can't go up more than $14. A lot of people are paying $109 and it's supposed to go to $134 for someone making less than $85,000 a year. So in that case, they go from 109 to 123. And the same would happen next year. It's whatever percent their Social Security goes up, their Medicare B can't go up further than that. So always keep that in mind. The other thing to keep in mind is at the end of the year, a lot of times we assume that doctors' offices have decided which plans they're going to take. Labs and blood tests and hospitals, all these things, all these different people, we think that they've made a decision before open enrollment which plans they're going to take, and that's not always the case. So the fail-proof way of knowing if your doctors and hospitals and stuff are in network are always to call the insurance company. You can check their website. It's usually pretty darn accurate. You can print off what you see, your doctors and specialists. You can ask your insurance agent who can look on their website as well. But the best foolproof way is to call the actual insurance company because those conversations are recorded. I bring this up as a cost saver because if you accidentally go out of network, in days gone by there was more latitude. Now it's very hard and fast. If you're not seeing somebody in network, even if it's on accident, you're still going to be expected to pay the entire cost. And this is particularly true when you talk about hospitals, because hospitals are not homogeneous. There are lots of businesses that operate within those walls. The people that run the anesthesia, the people that run the blood machines, the emergency rooms, the imaging centers, a lot of times they're different companies. And even the companies that read, for example, like a read an x-ray, could be a different company than actually perform the x-ray. Okay, so it's your responsibility, unfortunately, to make sure that anybody that's involved in building the system is going to be in network. So if you go to the hospital, ask for everybody that that's going to build a system, call the insurance company, make sure that they're in network, make sure it's clear to the person performing the surgery that they're not to use anybody else without discussing it with you. And it's hard for us consumers to think of healthcare that way, but we have to because the contracts are very clear now. If you go out of network, most times you're fully responsible, and that can cost you thousands, if not tens of thousands of dollars. And I've seen in my practice in 12 years example after example of that, and there's not much I can do at that point. I can try to file an appeal, but a lot of times it falls on deaf ears. So hopefully this helps you. Again, Welk Security and Trust in Spokane, Washington.